which is that. Good evening, everyone. Welcome to our September Arts and Health Research Masterclass. We are so very grateful to be able to offer this free for all of our singers and singers' friends through a wonderful grant from the DC Arts and Humanities Commission, as well as AARP and their support. So we are so glad that you're here with us this evening. You're in for a treat. We have our friends from Sounds Good Choir in Chicago with us this evening, and I'm looking at my other screen, so I've got too many things up. But we have Dr. Jonathan Miller and his wife, Sandy Siegel Miller. They are co-founders of the Sounds Good Choir in Chicago. Jonathan, prior to that, spent 10 years with Chicago Children's Choir, which I know very well from when I was teaching K through 12 music, and has also had experience conducting everyone from beginners to professionals. In 1993, he founded the Virtuoso Ensemble Chicago A Cappella and served as their artistic director for 27 years. And they have many choirs throughout the Chicago area, which they'll tell you about. And in addition to being a choir director, Jonathan has also served on the board of Chorus America, and has been a grants panelist for Illinois Arts Council and for the National Endowment for the Arts. And his wife, Sandy Siegel Miller, she is, again, co-founder, and also works with their Good Memories Choir, which is their dementia choir, so very akin to our Sentimental Journey Singers Choir. She's a clinical psychologist and has been in private practice for more than 30 years, and has been working with older adult choirs, which is a little bit of a pivot from that clinical work, but bringing that knowledge into this work has been very beneficial. So she is going to talk to you a little bit about the research that she is working on with Jonathan, and I'm going to go ahead and turn it over to them. Thank you so much for being here, and the floor is yours.
Thank you so much. It's great to be here. Can you all hear us? Can you hear me? Thumbs up? Okay, great. So I see there are 32 participants here, which is fabulous. We're just so glad to be here. Sandy is really the research brains of our organization because of her clinical training. As a psychologist, you'll hear a little bit more about that later on. But we've got a bunch of slides to take you on our journey of our research into our older adult choirs. I'm going to go ahead and start the PowerPoint.
And before that, I want to say hello to everybody and thank you. It's just an honor to be able to spend your precious time with you. And I'm a little bit intimidated by the Masterclass title because I don't at all feel like I'm the master of any of this big body of research that that is going on in the music world. But I'm delighted to be with you and to share with you what we're doing up here in Chicago.
And Sandy is unnecessarily modest, but here we go. We're so grateful for the opportunity. Let's go ahead and put these slides up. So let's see, I'm going to do a slide, set this from the beginning. All righty, this should do it. Let's give this a moment. There we go. Can I have a thumbs up or two if you can all see my slides? Okay, beautiful.
Great.
So this is us. Just to get us started, I thought this might be fun. This is our Sounds Good choir in the summer of 2018, singing a song I think most of you have heard before. Clap and sing along if you like. go all day, but we won't. So that was super fun. And if anyone tells you the choir is not fun, don't believe them.
So we thought we'd start out by just telling you a little bit about who we are and what we're doing up here.
Yeah, so as you can see, we have two primary programs in our organization, and both of them are replications of other people's great ideas. Our Sounds Good Choir actually began almost 10 years ago as an affiliate of your organization. The little backstory there, some of you may have been around this long. Back in 2012, I'm a composer and an arranger of choral music. I got a call from this lady in Washington, D.C., because I'd written a mashup of Jingle Bells on the Hallelujah Chorus. And this lady calls me up and says, I'd like to buy some copies of your sheet music. And I said, well, that's very nice, ma'am. How many would you like? And she said, I'd like 550. So of course the question was, who are you? And of course she was Gene Kelly, and she ended up buying 800 copies of the piece, which paid for me and Sandy to hop on a plane and hear 250 of you sing it in the Millennium Stage at the Kennedy Center. So anyway, fast forward a couple of years after that, I had lost my job in music publishing and was looking for a new gig. And Sandy said, give some thought about what you want to do. And I said, I want to bring that encore thing to Chicago. So we did. So at this point, we've grown it to 8 choirs for cognitively healthy older adults with about 450 singers. We were telling Marianne before we started that 3 of our choirs are enormous, and it's been really fun to watch those grow to more than 80 singers apiece. We've got some small and medium choirs also. And just like you, we have no auditions and professional conductors. We run 15-week spring and fall sessions. And unlike you, we do an 8-week summer rock and roll session with a live professional 4-piece rock band, which we've done since the beginning. And that's just super fun. Like you, our concerts are always free. And really, since the pandemic, I think we've been doing weekly online rehearsals. Every Friday morning, Paul Langford from our team does a free online practice just for anyone who wants it. And then Sandy can tell you about Good Memories.
Sure. Our Good Memories program, I think similar to some of your choirs, is also a replication of another great model, the Giving Voice model from the Twin Cities, Minneapolis, St. Paul. And just like your choirs, ours is a choir for people with early stage dementia, singing, most of them still living independently, singing with their care partners. And our choir is staffed by what Jonathan calls our secret sauce, which are the amazing volunteer singers who operate as singing buddies and do all kinds of other things to make that program work. We have 2 of those choirs in the Chicago area. And one of the features, I'm guessing yours is the same. One of the features that I think is very important about our choir is that when someone enters the room and sees all of us, singing or eating snacks, we seem to eat a lot there. We're all wearing name tags, but the name tag doesn't have a label on it. It doesn't say, I'm Sandy, I'm running the choir, or I'm so-and-so and I have dementia. And that's very important, I think, in terms of identifying the kind of and defining the kind of community that we are and the kind of community spirit that we intend to create.
So our rehearsal environment probably looks a lot like yours as well, since we're replicating your model, at least for the cognitively healthy people. We do about a 15-minute vocal warm-up, and I'm really lucky in that I'm still studying voice privately. I happen to be studying with Professor Karen Brunson from Northwestern University, who's one of the great pedagogues internationally in the mechanics of the older adult voice. So I go see her once a month and I learn everything I can from her and I teach it to all the singers that I teach in rehearsal, and I try to give stuff away to our other conductors as well. And then we go into repertoire, and that pretty much takes the rest of the 75 minutes because like you, we have pretty ambitious programming and we have a lot of repertoire to master in our 15-week session. And Good Memories looks a little different. So go ahead.
It does. As you can see, one of the most important features of Good Memories is snacks and snack time. We actually start out, we put the snacks table out and get it ready before rehearsal even begins. And we have many singers who come 15 or 30 minutes early just to hang around and have snacks before we start rehearsal. But we begin rehearsal by all singing unison, "Oh, What a Beautiful Morning," and doing some hand motions to kind of wake ourselves up. And then we spend about a half hour working on our repertoire, have a movement break, and more snack.
That's Sandy, by the way. That photo
Yeah.
is Sandy leading the movement break.
Yeah, until we find a better substitute for me.
You're very
But move and groove is followed by more snacks and then some more rehearsal of our repertoire. And we end all of our sessions by all together singing "Happy Trails to You."
lots of joy. So the question gets posed to us every now and then, and maybe gets, whoops, sorry, maybe gets posed to you guys as well. Sorry, wrong slide. Let me go back. One moment, please. Yes, here we go. Why would a relatively young arts organization actually want to do academic research? I think you all are quite a bit ahead of us in terms of the sophistication of your program evaluations. I know, Marianne, you do a lot with that. In a sense, partly because of Sandy's training, we'll tell you a little more about that. We kind of went straight to more academic research, partly because it's what Sandy knows. But after we'd been doing our dementia choir for a year, some remarkable things started happening. One volunteer in particular came to us and said, well, I signed up for this choir as a volunteer mainly because I was scared, because I knew I was having some cognitive slippage. I didn't want to admit it. So I signed up as a volunteer and I started singing in this choir. And what she said was, when I started in this choir a year ago, I was invited to be on my condo board and I said no because I knew I couldn't handle it cognitively. But she said, after a year of singing in this choir, my brain has been restored to health. Basically, you guys saved my life. And I said yes to the condo board. So that's an incredible story, but it's an anecdote. One anecdote does not a research method make. But Sandy started grooving on all this stuff, and I'll let you take it from here about that.
Yeah, thanks, John. My training, a lot of the training of a clinical psychologist, in addition to, the idea of working with patients, is, we are essentially trained as researchers. And my mentality is that one should always be studying what they're doing and studying it in the language that science and medicine understand, which is academic research. So that, as Jonathan said, that was my bias. And I think long before we had an executive director who said, hey, we ought to be studying the impact of what we're doing in a sort of an organizational sense, I was digging into let's communicate what we're seeing every week in rehearsal. Let's communicate that to the scientific and medical world. So, in some ways, my board constantly challenges me with the idea of should an arts organization like ours really be engaged in this type of research and this level of research? And that's a legitimate question and sometimes a difficult question to answer. But my answer is yes. So we partnered with a research team at Northwestern Medical Center at the hospital, and partnered with the physician, neurologist, who's the head of the music and medicine program at Northwestern. And I'll be talking a little bit about more about them and our team in a few minutes.
So as I said, people started telling us stuff. The third one, singing in this choir, has saved my life. But also we started hearing things in our cognitively healthy choir, like, I moved to Chicago to be near my grandkids. This may resonate with a bunch of you. And I didn't know anybody. And somebody told me about this choir, and suddenly I found my tribe. I don't know how I would have made these relationships any other way. I'm now socially, I see friends outside of choir. I can tell my brain's more active, blah, 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 stuff like that. And this kept prodding us. So come on, guys, you really need to study this. So
Yeah.
that's what we kept in mind while we were trying to figure out exactly how to do it.
And as Jonathan said, part of our goal is to take those anecdotes, take those quotes and those stories and translate them into, hard, what we call hard data, facts and figures and percentages, that we can converse in the language of the academic world. So I won't belabor this slide, but again, in our dementia choir, we were hearing the same kinds of comments about the positive impact of singing in a choir.
So the big question that you all are probably asking, this kind of what everybody wants to know is, writ large, how does it help people to sing in a choir? And so this is what we're trying to figure out, just like you.
Exactly.
This is going to come as no surprise. This is actually a slide that we put together for some previous presentations. You guys are really the mothership of all of this because it was Gene Kelly and Gene Cohen and all the people more than 20 years ago that put together the great creativity and aging study. And you all probably know this, but just in case, we thought we would mention that this was a national three-site study. DC had choral music. I think Brooklyn had creative writing, and San Francisco had visual art or something like that. They measured people for 2 years over a bunch of health outcomes, and the people who did the choir had the best health outcomes of all. And after the study, they said to Gene Kelly, "We're having so much fun, we don't want to stop. What you got?" Well, what you got is now Encore
What
Creativity.
you got is you guys. Yeah,
Exactly.
exactly. But I think that was a wonderful model for, academic, rigorous study of what is it that we're doing and what happens when we all get together and sing.
Yeah. Totally. So we wanted to build on this the kinds of stuff that everyone's been talking about, the kinds of stuff that was in the Gene Cohen and Gene Kelly study. Before COVID happened, Sandy kind of had this mapped out. Like, let's figure out some meaningful inventories and try to study them. And what we wanted to do was, and you may have some studies like this already, we wanted to have a pre-measure, what was it like before the 15 weeks of choir, and then a post-measure. What's like after the 15 weeks of choir, does the needle move? So this is kind of where we were going.
So I put together a really nice study, and this was in about 2019, maybe. Nice study. I actually worked with some colleagues from Rush Medical Center in Chicago and put together, what the outline of a nice tidy study that we were just getting ready to put the whole team together and hopefully launch the study when the pandemic happened.
Dun, dun,
And it's
dun,
like
dun.
life happened,
Yes. Most of
We
you are
make plans and life happens.
probably there. So we're going to jump forward 6 years now. This is a
And then work
picture.
backwards.
This is June of 2025 when our article was accepted for the Journal of Alzheimer's Disease. We decided to go out to dinner and celebrate. And now we're going to tell you what we actually studied that got published. But just to introduce you, on the left is Amy Karstens. She is a neuropsychologist from Rush. She's our current data crunching wizard. Clara Takarabe, second from left, is a professional violist and violinist who plays with the Chicago Symphony, with the LA Phil, among other places. She's an incredible musician, and she also is a community musician with a huge heart and an avid researcher. And she got together with the guy on the far right, Dr. Borna Bonakdarpour, who's a neurologist at Northwestern. And together they created this remarkable program called Music and Medicine, which looks at the intersection of those two disciplines. And they're doing all kinds of really cool stuff. And then there's me and Sandy.
Exactly.
And now, the reason we went out to dinner is we got this article published earlier this year, which is a nice sort of remarkable that we kind of hit a home run our first time up at bat, but we had a really good team and we had a really good story.
And
Tell them the
yes.
story of the story, if you would.
I'm
Like,
not
why
sure.
did we
I'm
even
not
do
sure.
this study in the
I'm
first
not sure what he's talking about, but that's okay. This publication was not the study that I designed back in 2019. That study happened later. But what happened was, I think this is what you meant, John.
It is.
What happened was when we were coming out of the pandemic, and I don't know what was happening down in DC, but in Chicago, we were in lockdown for all of 2020 and a good part of 2021. And as we were coming out of lockdown, where we were actually venturing out of our houses, or our singers were venturing out of, being locked in their care facilities, we followed up on conversations we've been having with Dr. Banaktarpour and said, hey, Borno, I think we can actually eat in a restaurant together. Let's go out for lunch. And
Outside, by the way.
yeah, outside. And the conversation with him was mostly about like, oh, what have you guys been up to? How did, the ones we were all having, like, how did you survive all of this? And we talked to him about what had happened for us, which I think was the same as you guys. We had to pivot everything that had been in person to online. So that's what we were talking about, the craziness of providing tech support for, 300 singers and trying to create a video concert and, all that stuff that many of you probably did. And Borna said, Dr. Banaktarpour said, you guys need to study this. You need to evaluate this because this is pretty remarkable what you did and what you guys did. So literally in November of 2021, we who knew almost nothing about program evaluation, I might add, we put together a 5-question survey, which is what he said. All you have to do is figure out 5 questions to ask your singers, do a survey, and we'll have a program evaluation.
Go to the next
Never
slide. So you
dreaming
can
that
see,
it would end up being published.
so you can see what the questions are.
Yeah.
Although I have to say, Borna said, well, he said, if you had 250 people doing online programming during COVID, I think there's an article in there.
Yeah.
I think there's a very good chance this thing is actually going to be publishable. So these are the questions. You can see, not super complicated.
Not super sophisticated.
Did participating in the program do these things? And so what the other thing that we should mention is if you go back even further to July of 2020. So we are in the thick of the pandemic. There are no vaccines. There's nothing except fear and isolation. And most of our people in our dementia choir they either died or moved away or went into care facilities. Our whole dementia choir kind of vanished online. But Sandy noticed in particular that the people with dementia who were still around could not learn brand new sheet music from scores online. Just not going to happen. So what can you do for those people? So Sandy said, let's do it. Let's make something super easy. Let's do an online sing-along once a week of songs that people already know. So we did.
Yeah.
We started that in July.
Great time to start a brand new program.
Yeah, but
we needed it.
But we needed it. And at the same time, right around the time Sandy decided to do this, we got contacted by the local area agencies on aging. There are 3 of them in the Chicago area. The 2 that run the suburbs work very closely together, and they said, our memory cafes have all vanished because everyone's stuck at home. People don't have any kind of programming. What can you do for us? So Sandy said, well, let's have our first sing-along be for people with dementia.
Mm-hmm.
So we ran that for the second half of 2020, and the area agencies on aging stepped up and paid for it. How do you like that? That was pretty cool. Then what started to happen toward the end of 2020 was some of the singers in the Sounds Good choir, our cognitively healthy people, they started hearing about it.
They were getting jealous, yeah.
Right, and they got jealous. And they're like, well, we want to sing along too. But because of the funding silos, we had to run 2 separate programs. So what we ended up studying in this slide that you can see is we had a choir for cognitively healthy people. We had a choir for people with dementia and their care partners. We had a sing-along for cognitively healthy people. And we had a sing-along for people with dementia and their care partners.
Right.
So these 4 colored bars are what that is.
Right. So yeah, so what you're seeing here in terms of for those of you who geek out about data analysis, I'm going to try to make this very brief, but we had 2 levels of program and 2 levels of group, cognitively healthy, neurocognitively disordered, choir, and sing along. And then we had people answer each of these 4 questions. There were actually 5. The 5th question was what we call free response. We just said anything else you want to tell us that we didn't ask about. And people answered that on what we call a Likert scale, a 0 to 10 scale. And so we broke that into 3 categories, and analyzed the data that way.
Yeah. So this is what we found. We had a couple statistically significant results, and that was pretty nice. So we got to put those in the article. And the bottom part was it taught us how to ask better questions,
Indeed.
which is always a good thing.
Indeed. And just a couple of remarks about the publication. So we ended up being published in the Journal of Alzheimer's Disease, as Jonathan said, this past June. And what's interesting about the article, in addition to the fact that it's ridiculously long, like 30 pages, I think, a lot of that article is methodology. A lot of it was a very detailed description of what did we do during this pandemic. And I think there continues to be interest in the possibility and the opportunity that online singing could have, for remote areas, for rural areas where there's, a challenge to access, music and choir experiences. And I think that's part of the reason why there's such a long, in my experience with research, such a long description of actually what we call the methodology, like the program itself, like what did we actually do?
Yeah, and another big part of the article is what they call a lit review, just bringing people up to speed on what's the state of knowledge in this discipline.
Yeah.
And so that's also important. Another thing that some of you may have seen, I don't know if this was part of the sort of publicity for our talk tonight or not, but we had the privilege of being written up in National Geographic earlier this year by a woman named Mercedes Kane, who's a wonderful writer and a documentary filmmaker. She's in the middle of raising money for a documentary about the Giving Voice choirs in Minnesota and our Good Memories choir here in Chicago. But in the meantime, she went to what's called a pitch conference in Boston earlier this year, and she got nibbles from the New York Times and from Nat Geo, and Nat Geo took it all the way and published this article. So if you have a chance to see this, you have to put your email address in order to get access to the article, but it's a really, really nicely written piece.
And beautiful description of what's going on up in Minnesota.
Yeah.
The great work they're doing.
So finally,
recently, a couple of years ago, a year ago, we got back to doing the study that I had thought about, to begin with, and we put together the research project to evaluate for our now in-person choirs some of the hopefully positive effects of singing in a choir.
Nancy, you've got a question, I think. Okay.
Yeah, I think she's doing something.
Okay, good. Screen. So this is the study that we wanted to do before COVID happened. As I said before, it's you have a pre-measure, so people take all these inventories. These are online, sort of tests, if you will. How did you do before 15 weeks of choir? How did you do after 15 weeks of choir? And because we weren't able to come up with a control group, I can let Sandy tell you what a waitlist control is, which is better than nothing.
Mm-hmm. Yeah, so we also put into the design, as John said, a waitlist control. And what that means practically is that we were evaluating our fall 2023 session, which begins in September. So what we did was take some measures in the beginning of August, a month before choir started, and used that as a baseline measure. So that was our first administration of these inventories. And then we did an administration of the same instruments at the beginning of our 15-week session and the end of our 15-week session. Yeah. So that August measure kind of serves as an indication of what, how people were doing before we actually started the intervention.
Do you call that a within subject? Is that what that's called? A within subject waitlist? Okay.
No.
Anyway, because the idea is if something really wonky happens between your waitlist control and your pre-intervention, then there's something strange. But ideally, there shouldn't be much change.
We didn't want people to get tremendously better during that month of August. We wanted to see them doing better in December.
That's
after
right.
we had
don't get better. Wait, don't get better.
Exactly.
So these are the kinds of things that we were studying, and these are standard
Yeah.
inventories.
Yeah, exactly. You may recognize some of these. These are, we gave again a battery of inventories. Time looking at things like anxiety, depression, loneliness. Some of you may have taken some of these inventories actually. Purpose in life, which is one of my personal favorites, and a very treasured colleague, Patricia Boyle from Rush. Caregiver burden, etc. And this is fast forwarding to our results. What we're seeing, we're still analyzing this data. We're almost finished analyzing, um, because we actually did some post hoc analysis after we got our initial results, and I can tell you a little bit about why we had to do that. But what we did see are, in that 15 weeks of, after the 15 weeks of choir, we saw a statistically significant reduction in anxiety, and a statistically significant reduction. Oh yeah, the p-values are there. The percentage values are there, in negative affect and negative mood, on the Rush negative affect scale. So those are some nice results. What I think is also interesting about the data that this generated, I'm looking for some input from anybody on your team that might be able to comment about this, perhaps at the end. One of the things that we have been wrestling with is that on these measures, for example, loneliness, purpose in life, where I was really hoping to see, positive change, what we realized is that the baseline level of our singers is really great. And that, I mean, that's wonderful news. Like, you guys who are singing in our choirs, when we ask you how lonely you are, you're already not very lonely, even before the choir session starts. And you're a little bit, better at the end of the 15-week session, but not enough where a statistical analysis is gonna highlight that. So it's sort of one of those paradoxical things where the great status of our population, and in this case it was about 180 singers, the fact that everyone is doing really well makes it very hard to measure and document positive change.
Yeah.
There's just not any room to grow. It's sort of like if you're asked to rate something from 1 to 10, and your first answer is 9, and 15 weeks later it's 9.5, that's not going to be enough of a change, for the statistics to be able to reflect that. So one of the things, I'm getting ahead of myself, but
To go to the next slide.
as perhaps, I don't know what the next slide says.
Yeah.
Yes.
Topping out
This is good.
topping out the scale.
One of the things we plan to do as a next step for our team is to replicate the study that we did in 2023 and improve it, which is what you always hope a replication is going to do, because that really was a pilot, what we call a pilot study, like a study where you're going to learn a lot of stuff. And we did. One of the things we learned is that we need measures that are more sensitive. We need inventories that are going to be able to detect the positive change that we still know is happening in our choir. But for example, rather than using the 10-item version of the purpose and life scale, probably we need to use the 20-item version, same scale, but more detailed. Maybe that'll pick up, some of the more nuanced change and improvement. So if anybody's in that realm and has suggestions or comments about that, just in terms of methodology, I would be delighted to talk about that.
Yeah.
But also, to add to this replication, we'd like to measure something about sense of belonging or social connection, because as many of you probably already know, that is emerging as a major risk factor, people who don't have social contact, who do feel isolated or lonely, that represents a significant risk to health, to mortality, to risk of dementia, for example. So we definitely, our study, ought to tap into that and measure that. And I'm still looking, as we look ahead, I'm still looking at, what's the best scale to give, or scales perhaps to measure that.
Yeah, one of the interesting, sorry, go ahead.
I just want to add, in addition to that, we're going to add a genuine control group instead of a wait list control group. And we've got a cool group of people actually in the same church building where our dementia choir is. We have a group of people who meet every week for about the same amount of time that our choir meets. They're meeting on a different part of the building. And they're a what do you call it? Events group. They, I guess, talk about the news, which to me would, I think they're going to end up feeling very depressed if I have any guesses about that. But anyway, that's probably going to be good for our study. But it's a group that meets, at the same length of time each day, each week, and the same 15 to 16 week session that parallels the session of our choir. So,
Yeah.
And it's a an older adult learning environment, that program that church has. Also, I just want to add, we also want to and need to add a biomarker, and a biomarker will hopefully allow us to qualify for some particular kinds of grant, sources. And a biomarker is the way medicine wants us to look at the effect of something like a choir. So we need to measure something physical, physiological. It can be pretty simple, but knowing us, we're looking, and Jonathan will talk about this, we're looking at some very cool sort of cutting edge stuff. And we'll see where we're able to go with that.
Yeah, that's great, Sandy. And I told you Sandy was unnecessarily modest earlier in the talk because she's really on top of all this stuff. So Borna Barnakdarpour, our neurologist from Northwestern, says, the NIH considers, for example, all these online self-reports about mood and loneliness and sense of belonging. All that's great, but it's a little too squishy. And so they're like, we need to see something that's going on in the body that we can measure, that's physically demonstrable. And we're going to tell you a little bit more about that. So we had the privilege at the end of 2023 to be invited to present to this incredible powerhouse group of Chicago women known as the Know Your Chicago group. And rather than going on tours of Chinatown or West Pullman or the Frank Lloyd Wright neighborhood in Oak Park, they decided to do a tour of the brain. And so who did they call? Borna Barnakdarpour from Northwestern, because this is his jam. So I love this slide. This is actually my screenshot, my photo of his slide up on the presentation. At this we were all on a panel together, and he has put together this diagram of all the different ways in which a single sound signal stimulates the brain. I mean, this is incredible. If you look at this, the auditory limbic pathway, it basically, even what he tells us is that even before your brain processes a sound wave as sound and tries to go, oh, just major chord, minor chord, jazz, pop, hip hop, whatever, it goes into your limbic system and your feet start tapping to the tempo, because that's just what happens immediately. And then your brain starts doing all this other stuff. But this graphic is all the different ways in which a musical signal touches our cognition. And so it's another reason that dementia is slow. When a lot of other faculties are gone, music is encoded in so many different parts of the brain all at the same time that even if you have Alzheimer's, which dissolves the brain from the outside in, so much of what's going on with the way we store and perceive and remember music is deep inside the structure of the brain. So I just thought it was totally cool, and we may find some ways of measuring some of this stuff with biomarkers as we go forward. But in the meantime, back in March, we were privileged to have a visit from Dr. Jose Contreras Vidal, who's a biomechanical engineer from the University of Houston. This guy has developed the world's first Bluetooth EEG helmet. So electroencephalograms, until now, you had to be wired up to something in someone's office and you couldn't move around very much. Well, Pepe, as we affectionately call him, has come up with this thing, and it takes about an hour to put it on your head. You have to put all the electrode gel on there just like you normally do. But this is a portable EEG, and so he's tested it with jazz musicians, and it had never been tested before, as far as we know, on choral singers. So he came to Chicago because he wanted to work with some other people that Born of an Octopour was working with. But he brought it, and we wired up two of our singers in our cognitively healthy choirs, and on the next slide, two of our singers in our dementia choir. The guy on the right is a person with memory loss, and the woman on the left here is a cognitively healthy alto in our Monday choir. But each
His
of these,
care partner.
actually his wife is his
Okay,
care partner.
yeah.
But anyway,
Oh, that's not her. That's
nope.
it.
Each of these helmets does the standard 32 points of brain activity that a stationary EEG would have. And then what I'm going to show you on the next slide, this is Pepe giving a talk to our choir about what's actually going on in real time on the wired up singers who are still in the room. And let's see what he says.
Motor. So we had this full view of what's happening, right? And then, no, we have some software programs that align the signal, right, and extract feature. So some of the things we can do is develop brain-computer interfaces, right? Maybe you have heard Neuralink, and some of the news about.
So what you're seeing is every second, 60 data points are being measured, and Pepe is now training people, including a team from Northwestern, in how to analyze this data, because it's scads of data.
Yeah, I think we didn't show you this because we thought you would be able to hear and understand what Pepe's saying. I think it's just it's sort of a visual example of the massive amount of data that this generates when you've got 64 channels coming in, and it's sampling. His program is sampling, several times per second. And it just generates, a tremendous amount of data. But one of the things that we could see in real time on the computer was that as the two singers, whether it was, person with dementia and their care partner, or the two cognitively healthy singers, as those two people started to sing together or even listen to music together, their brainwaves started to sync up. And what were two separate groups of lines actually they kind of melded into one line.
Yeah, it's amazing to see it in real time.
we don't know exactly what that means yet. It certainly means something, but we really don't know how to interpret that
And
yet.
this may be another paper after someone at Northwestern learns how to read the data and
Right,
then
right.
can write
So
it
that's
up.
where our team is. We have some training going on, communication between Pepe's team in Texas and our team up here, and training to have us analyze this bucket load of data.
Yep.
Motor.
That's a lot. There he is again. So in terms of the long game, one of the questions that sometimes we get asked is like, well, where do you see this going from here? And we'd be curious as to what your response might be, both sort of from Encore writ large and individually. But one of the things that we've had our eye on for a long time is the possibility that if we study our stuff enough and we get enough of the right kinds of answers, that insurance companies will start to see choir as an evidence-based non-medical intervention that improves the lives of older adults enough that Medicare Advantage or Blue Cross or Medicare itself will actually pay for people to be in our choirs, which would be incredible. And that may be a 10 or 15-year long game.
I hope not that long, but it could be.
You probably know in the UK they have what's called social prescribing, where if you go to your general practitioner and, for example, you have PTSD, they'll write you a prescription for a welding class. Or if you have dementia, they'll write you a prescription, what we call the social prescription, to go sing in a choir. And that's just now starting to happen at the state level, which is how it's administered here with Medicaid in a couple states.
Right. And many of you are probably familiar with the fact that, insurance insurance in general in our country is starting to move more and more in the direction of prevention, especially for older adults. They're paying more attention to, gosh, what if we decided to, get involved in and start funding people trying to stay healthy, and rather than waiting until they're
In the
very
ER,
sick
yeah.
and paying for that. So I think I'm hoping that we can be part of the big group of interventions that insurance companies are starting to put together, to prevent, diseases and prevent, the bad outcomes, as well as hopefully delay the progression of something like dementia.
Yeah. So that, my friends, is the end of the formal part of our talk. If you want to contact us, these are our email addresses, super complicated, smiller or jmiller@soundsgoodchoir.org. There's our website. It's a website for a choir.
Yeah.
You've got one too.
Good.
So
and we'd love to hear questions if you have them. I don't
yeah,
know.
so we're
I don't
gonna-
know, Marianne, if you have a suggestion of how to field questions or.
Sure. We don't have a huge group. So if you are more comfortable popping your question into the chat, feel free to do that and I can relay it. Or if you would like to raise your hand and unmute and ask a question or give a comment, we certainly want to have a chance for you to respond.
And again, we're just so grateful for the opportunity
Yes,
to
it's so
get to
great
hang
to
out
be
with
able to
you all.
spend some time with you guys.
They're all thinking.
That's fine. Take
It
your
was a
time.
lot of
We
information.
threw a lot at you, yes.
Good.
Absolutely. Francie, yes.
Yes, thanks so much and congratulations.
Thank you very
Thank
much.
you.
We appreciate that.
Yes, what a thoughtful study with a high note, hopefully at the end. Yes.
Thank you so much.
I had occasion, quite unexpectedly, last night to read a blog that's jumping off point was the fact that a radio station in New Jersey brought onto its DJ lineup an individual who was prominent in the New York market as a performer and radio jock in the 50s, 60s, 70s, and 80s. So he had a following and he had staying power. And I suspect he's probably now in his 80s. And this station has brought him on to do once a week a 2-hour gig in his particular lane of music, which is doo-wop.
All
So
right.
a man finds out about this and he writes on his blog, he got engagement by 6 people. Okay, 6 people. I don't know how many read it, but 6 took the time to respond. Not necessarily lengthy, but I thought they were thoughtful and they crossed the T's, they dot the I's, they were formally appropriate. His article, however, said 3 things that jumped off the page. And he's allegedly, he's probably in his 60s or 70s, allegedly worked for 35 years as a writer for a major New York newspaper, but not the New York Times. And he said, number one, the station that this man now can be heard on, the station is has people who are DJs who have varying skill levels. Whoa. So that was amazing. Then and it was all very matter of fact. He then said, this station plays a very predictable format of music. The people who are listening all know these songs. They're reliving their past And that's why they're listening. And here now, Miller's, listen up. Here is where you come in. He then lowers the boom and says, all the research shows that people who listen to the same music over and over are not gaining any of the cognitive brain enhancements that they might if they were listening to music that they did not know, were not familiar with, and had to really apply themselves to connect with. So forgive the big preamble. I'd love to hear what your take is on that. And again, he cited no studies for his assertion with respect to the studies he cited. Thank you so much.
Wow.
Thank you for that great story. I think you're correct. I'm not aware of any studies that would support, his hypothesis, although it's a really interesting one. What we do know is that, and some of you may know this as well, there's this sort of sweet spot for music that is remembered, especially for our population with dementia. And it is the music that we heard probably during our late teens or mid to late teens, all the way up to probably around age 30. And there is some theorizing that one of the reasons that music is so sort of permanent in our brains is because we heard it so many times that those neuronal connections have became so strong for those particular songs. And I'm guessing many of you have had that experience. You hear a song from your teenage years and you can remember every single lyric. That music, by repetition, has just become, rock solid in our brains.
Yeah, the converse of that, if I may, is that I think part of what you're pointing to, Francine, is that listening to brand new music that you've never heard is also going to stimulate
Yes.
new neuronal pathways, because your brain's going to have to come to grips with this brand new information that it's never processed before. And this is just anecdotal, but I'm giving myself sort of a challenge to, my daughter is in Portland and she's 31 and she listens to all kinds of different stuff. She sends me new, albums to listen to from time to time. I'm trying to listen to a new album every week of stuff I've never heard because I want to try to expand my own horizon. So those are two sides of the same coin.
And to support what you're saying, John, in the non-musical world, I was just reading an article. John and I do the New York Times spelling bee every morning, and a couple other brain puzzles, which I was just at a conference last week, and the researchers there from Northwestern and Rush said, that's all well and good. That's good for your brain. What's better is to try some new puzzle that you haven't done before and give your brain a little bit of a workout. So, there may be something to his theory.
And yes, just to support and really amplify the absolute spot on insights that you both shared, my opinion, it turns out that the spectrum of music, the chronological span, when the people who are now listening, who are typically north of 60, maybe the sweet spot would be 75 to 85, they would have been listening to this music when they were 18 to 30.
Yep.
Yeah.
And the another part of that is when we're trying to fill up our summer rock and roll choirs with paying customers for those 8 weeks between June and August, it's moved forward a little bit, but before COVID, it was like 1957 to 1968, maybe. We kind of figured out. Just part of it was trial and error, but I think at the time our average singer was 74, and we sort of worked our way backwards. And you could get people who were excited about stuff before the British invasion, but not too much. And now we're 7 years later, and we're pretty much starting with early Beatles and working our way,
Early
inching our way into
60s,
Carole
early
King. And
70s.
I think we did Stairway to Heaven a year and a half ago, and we could get away with that.
Yeah.
But as our singers age, I'm
Mhm.
63. I graduated high school in 1980, so I'm a little younger than some of our singers. But I'm really looking forward to the time when the sweet spot of our singers is
I'm sure.
1971 to 1979, because that's my era. So we'll get there at some point if we stick around long enough.
Yeah, I'm finding that with our melody makers groups, which are for later stage cognitive change. So a lot of times we're on the memory care floor. But, when we started several years ago, it was still kind of Frank Sinatra, the crooners kind of thing. And we can still do some of that. But now we're into more of the Beach Boys and the Beatles, and yeah, it's interesting to see that needle move. And I know with our rock and roll choir, we do a combination. I mean, we've done some modern stuff, and we say, hey, you might not know this, but your grandkids do. So bond with your grandkids and sing some Coldplay. But kind of mirroring that with some Bob Dylan and some things that are more familiar to their generations. So yeah, it is interesting to see that needle move a little bit.
Yeah.
Other questions?
Are there any in the chat?
No, not yet.
Okay. Someone would like an email address.
Yeah, she did it. She
Oh,
put it- she
okay,
put it
good.
in there. Yeah.
Okay, good.
Yeah.
Anything else?
We could.
Gene, yeah.
You're muted, Gene.
There you go.
Yes. This might be something for the future or maybe the present, I don't know. But you mentioned using EEG to map areas of the brain. Have you considered using more sensitive and selective methods like positron emission tomography and functional magnetic resonance imaging?
We certainly have considered that. And you may be aware of that those are both of those kinds of scans are very expensive, not super portable. But boy, those are some of the gold standards. Would we love to be able to use those? Yeah.
Yeah.
That's why I was thinking that it's probably something in the future.
Yeah.
Yeah, probably so, Gene. I think the one of the real blessings of the portable EEG is because it's so portable. You can, if we could figure out. Well, one of the things that Borna mentioned, our neurologist, is that, and when Pepe was here, he said you don't necessarily have to have all 32 electrodes. You could do something that's much more cost effective by getting it down to one or maybe three or four spots of the brain that you were really interested in. Like right up here, there's I forget exactly what it is, but there's something about music and executive functioning, one of the spots in the brain, and it would be interesting to test that out. The other thing is when you have portable technology, you can do it right there in the rehearsal room.
Yeah.
fMRI is fabulous, but the only way right now that we could do that is have people walk the 4 blocks from Fourth Presbyterian Church to the Northwestern Neurology Lab after rehearsal, have someone lie down, whatever it is that
Yeah.
I'm not up on that, but that's another sort of, Gene, that's another holy grail for us.
Yeah.
That may be a 5 or 10 year aspiration, but it's a good one.
Thank you.
Any other questions? Do 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 do. All right. Well, is there anything else that you'd like to share with us?
I think just gratitude
Yeah.
that you all are, willing to spend an hour with us and talk about this stuff. And we're just so
Indeed.
grateful for our collegial relationship
Yes.
with Encore. That means so much to us. I mean, you really, if you weren't there, we wouldn't be doing what we're doing. And we're just really happy that
Yes.
that we get along so well and that we're willing to share with each other what we're learning, and
Yeah.
let's keep that going.
Yeah, and as we've discussed before, Marianne, in other settings, you know, we would love to collaborate. I think, you know, one of the, and I'm not being modest here, but one of the reasons I think that we were able to publish in JAD is because we had such large numbers of participants. And you know, a lot of medical research, as you probably know, involves very small numbers. I mean, great studies are done and published that have 8
20,
people.
yeah.
So when we come along, especially if we do a collaboration, you know, we can come in with a study of, you know, 1,000 or more people. Not only does that make the statistics a lot more robust and solid, but it's, you know, but it's
Gets people's attention.
it sure does. In the medical world, it sure does. So I know, I mean, I'm hopeful that we're going to be talking, that Encore and Sounds Good are going to be talking in the future about some research collaborations. I just think it'd be, not only would it be great research, but it would be fun.
Super fun.
Yeah, absolutely. Absolutely. All right. Well, thank you so much for being with us. And thank you to our audience for being with us. There's lots of thank yous in the chat that it was just a great presentation, and the information was very interesting. And we're very grateful that you all are interested in learning more about this as well, as our singers and friends of our singers, that there's a lot of this going on, and all of this research is hopefully going to help make the case for, you know, why we should all be singing and why it should be funded and supported in many, many different ways. So thank you so much for joining us this evening. Again, thank you to the DC Council of Humanities and Arts and AARP for their support to offer this programming this evening. And we will say good night, and we'll see you again in October. Thanks so much.
Take care. Thanks, everyone.